I received a commentary and question about neuropathy. Neuropathy is, of course, the dying off of the nerve endings and the burning sensation and the numbness that will eventually come. And of course, we don't want that. Restless legs, burning feet, cold feet, all these things are signs of pre-diabetes, if you're not diabetic yet. And it is signs of insulin resistance. That's why your doctor said the only thing that you can do is to lose weight. That will help you. But it's not the weight that is really the problem. Is you are insulin resistant, and that is the problem why the nerves get damaged. So absolutely you should do the carnivore diet, and you should take it very, very seriously. And I will suggest that you do the lion diet. I bought meat this morning. I'm on the lion diet. I'm a couple of months in on the lion diet. And since I started the lion diet, which is the stricter version of the carnivore diet, it goes much better with me. I only drink water and coffee, black coffee with butter in it. You can eat as much butter as you want. I've just done 100 push-ups, and this is now my 5,900th push-up for the year. It's the 59th day. I'm 49 and I want to exercise, and you can always look at your health. It's one of the parameters to look at. If you want to exercise, if you have the desire to exercise, then you know it's a good indicator of health. Not always, but it's one of the parameters that you can look at. My current weight is 78. On this scale you see 78.4, but I just ate a 400-gram steak, so you can subtract it. So we support Banting, Ketovore, and Carnivore, and the Lion Diet on this TikTok and YouTube channel. Being Lion Diet being the stricter version of them all. And so I also want to ask you, if you are on hypertension medication, statins, you need to discuss it with your doctor, and as soon as possible you need to get off those together with your doctor. I'm not advising anybody to stop their medication, but what I say, discuss it with your doctor. And you'll see, if you do the carnivore diet, you can go off those medications, and of course cholesterol medication as well. Cholesterol medication is very bad for your nerve endings. The myelin that is around your nerves are made from cholesterol. Now, perhaps you are drinking cholesterol medication, and those are breaking the nerve sheath that is made from cholesterol. So cholesterol, if you have high cholesterol, does have a risk for heart problems, heart disease, but it's only a 1.6 risk factor. If you have hypertension, you have a 4.5 risk factor for heart disease, according to the Women's Health Initiative study that ran for 10 years with 28,000 women. If you are diabetic or even pre-diabetic, you have a 10.7 risk factor. With other words, it's a 10-fold risk towards somebody that might experience a little bit higher LDL. So my LDL might be a little bit higher, not sky high, but it might be a little bit higher, but it's only a 1.6 risk factor. What is a very, very high risk factor is if you are diabetic, pre-diabetic, or insulin resistant. Because let me explain. If you are insulin resistant, you also will have high uric acid levels, not even at the level of gout or arthritis, which is at 6 or 7, at the level of 7, but you might have 5.5 high uric acid levels. Those also make your arteries and veins not elastic. So you get neuropathy as well. You get the numbness, the blood circulation that is restricted in all the areas, even in the brain. You get a 32% chance of stroke. You get a 38% chance of getting vascular heart problems. You get a 55% chance of getting vascular dementia because of high uric acid levels. So where does it come from? Insulin resistance upregulates your uric acid retention on your kidneys, and there is your high uric acid levels, and your hypertension as well, because insulin resistance upregulate your salt retention, and there's your hypertension. So what I say is, consider the carnivore diet and really give it a go. The biggest gift you can give your loved ones is your health. And you sound like a young person, or not an old person. And what I say is, if you're not going to sort this out, this is going to give you the pre-diabetes that you have, or the diabetes even that you have, and the insulin resistance and the neuropathy that starts to develop. Is going to give you problems in the future. Let me tell you why. What's going to happen is, if you start to lose feeling in your feet, you can step into something and you can get gangrene. When you start to lose feeling in your feet, you can lose your balance and you can hurt yourself badly. You can break a hip and the marrow goes into the blood and you can get a stroke. So this is what often happens with older people when they get these problems. But it's absolutely reversible. Insulin resistance, type 2 diabetes, pre-diabetes, hypertension, high uric acid levels, absolutely reversible with the carnivore diet. So check it out. Check out the frequently asked question playlist on my YouTube channel. Check out the testimonial playlist where I interview people that had similar problems to you, and they resolved it very quickly. They thanked me. I've put their commentaries on, and I made videos for them. Hypertension medication stopped. Cholesterol medication stopped. 26 kilos down, 40 kilos down, 80 kilos down, 170 kilos down even. So check out the testimonial playlist on my YouTube channel. Please remember to subscribe to my YouTube channel. We are almost on 900 subscribers. I only need 6 subscribers, then we are on 900. Thank you for everybody that subscribed.